back, everybody, to another episode of Podcast on the Go with me. Uh, Once again, I have a returning guest. Previously, she was not yet an official medical physicist, but now she is, and she's gonna be talking about her advocacy or campaign during this health crisis that we are experiencing, the global pandemic and succeeding quarantine and lockdowns. So our guest is Rosa, uh, the return of Rosa Belarmino, and okay, there's the layout. So,
Hi.
hi Rosa again. Hello.
Hi.
Okay, okay
Hi,
ako nakamute.
Greggy. No,
Sige, nakamute
no.
ko ba? So,
Wala.
Rosa is here to share about her advocacy or campaign, which is hashtag wear a mask, save a life. Sakto? Ah, sakto.
Yeah.
Yeah.
So the title of the project itself is like Wear a Mask Save a Life campaign PH. Many Filipinos, like not just those who are in Cebu right now, I also have friends who joined in the campaign who are in different parts of the Philippines, and also we have OFWs who have donated through the campaign. So that's why I use the Filipinos by the Filipinos.
So how did the campaign start, or
Yes, the
in Cebu? Was it in Cebu
campaign
or visit
started.
from you?
Yeah,
Okay, go ahead.
I started to repack the mask, just a simple box of a box of masks, and then I repack it by two, and then I was planning to give it out on the next Monday because I it was during my day off last July 24th. Then I posted it, I shared it on the social media, like on Facebook, on Instagram, and then people started to message me that, hey, how about I sponsor a box of masks? Like, so from that, there on, from sponsoring a box of masks, sponsoring in cash, they were already sending donations through GCash, BPI, and so we have we have successfully donated. We have gathered not just the mask, we have also donated bread from Julie's Bake Shop. So we also asked help from Julie's Bake Shop that they help us stretch our budget. And then we also were able to donate no, bottles of water. So that was the first target of the campaign was to, my personal target was to reach out to those who were um, along this, you can see along the street. So I usually walk to and from the hospital at my workplace. So going there and going back home, I can see that there are some people na wala gyud tarong naman. Kanang you can see that they are just like putting cloth mask or like maybe not just cloth mask, not may napay uban na bandana. Huh?
Like this.
Yeah,
Like this.
like that. No, ang ingon ana usually I can see the military policeman that they wear that. So for me, I've read studies and then news about the effectiveness of masks. So different masks, they studied different masks, and then they they try to see which is effective to reduce the transmission of COVID-19. So for me, since I'm a hospital worker, I bought my own respirator mask that I use almost every day, and then I'll just wash it because it's reusable. It's good because it's reusable, and then I can use the filter for about 3 to 6 months. And then so
So
since
how much is that usually?
so the the mask, those kinds of masks, like the 3M respirator mask, they would cost about, maybe the cheapest you could get for is around 2,000. Per there was a time that it reached like
Pesos, no?
4,000 pesos. Yes, 2,000. That's the cheapest you can get for it now. So, well, they're already, since parang nag-replenish na ang stocks. Kasi 'di ba naabot ang time na ang atong
So
surgical mask,
filter is sold separately,
those are sold separately, and some
but
online
the first
sellers
one
will,
package
ay, there are packages. So,
ah,
depende sa seller. So, usually, you can, I actually purchased my, ano na, this filter for the next month because I started to use it around June, like that. So, anyway, so I felt that I was privileged enough to have a respirator mask. However, the others who wouldn't be able to buy masks, what would happen to them? Like, how would we able to help them? Like, I'll send a donation of mask. Anyway, so at the time, so already that was already July, no? So the pandemic started around was WHO declared pandemic by March, around March, diba?
March,
So we already started the community quarantine in the Philippines around March, diba?
mid
Or
March.
mid March. So from community quarantine, how many months after, there is still continuous pa ang pag-rise sa, sa COVID-19 cases. And then I I I personally can see, like I've experienced now, since we tried to help that help the doctors, like the logistics team, Department of Internal Medicine, VS MMC. So I know we try to support them. So the doctors, so na makita, we can see that we witness how tired they get already. They're so, yung parang wala na tarong na relibo in Bisaya. They have parang, they parang na-reduce na gyud ilang energy. So, this is just a part of the solution that I'm trying to raise to the people, that we properly wear our mask. Since others can't really have masks, we try to reach out. So I give out um, free masks to those who are in the checkpoint, to our barangay workers, also those.
So what type of
So
masks are you giving away?
yes, the type of mask that I'm giving
Not the
away,
respirator.
not the respirator because I don't have the budget, and the campaign. Though the campaign is growing, there is money in the campaign, but it won't be able to support buying the respirator mask. So right now, it is recommended to have the N95, fitted N95. That's one of the best. Then second is the surgical mask. So in our current situation, we need to reserve our N95 mask to our medical health workers. So we don't we don't give out those kinds of masks, but they would be best one for us. Sana. So we go for the surgical mask, which is also cheaper. And then since supplies right now are, ano na, expanding na, daghan na, replenish na itong supplies. So the cost of the mask have also reduced. So it's easier for other people to like sponsor a box of masks.
So is it reusable or no?
No, it is, if you're in the medical
Ah, okay, of course.
situation, okay, uh, if you're a medical worker, you need to dispose that as frequent, no? And then um, there was also a doctor, my colleague doctor, who said that parang if if you're not working in the medical, like the hospitals and the medical field, you can try to prolong the use of the one surgical mask. But when it is soiled, soiled, basa na gid siya, please dispose it because it's really not healthy na.
What if gihumlan og alcohol?
Really, I that's
Ah,
one of the
FAQ.
we yeah. So it's a FAQ. So at first, diba, we try to prolong our mask, the call that. yung ang pag-use nimo sa mask kay example today, example N95 ba, ang N95 mahal baya and then lisod ang stocks. Medyo karon bisan karon you can't just purchase it on your regular drugstore. So there were times na we thought of like mag-spray lang mi sa mask, ano, and then nabadlungan mi because ano siya, it will uh it will destroy the purpose of the mask because it example the surgical mask you try to unsa na ibutang nimo siya under flowing water. So 'di ba makuha nila na it will try to retain the water here. Or try to spray alcohol and then you do that again, mo-leak na siya. So it will uh, destroy the
It will damage the material.
damage the material of the mask. So let's not do that actually. You can um
Same with
the
this, with the
hospital
with this.
hospital workers or some of the hospital workers are provided with the UV sterilizer sa office. So you can put it inside the UV sterilizer and then reuse it after kanang N95. That's the usual way of how they reuse it. Or there's this concept that I think it makes sense. Example, so if I use this mask on Monday, after Monday I can leave it, hang it air dry, and then I'll use it on maybe on Thursday or Friday. And parang mag-interval. Then you have another mask for day 2, another mask for day 3. Since there's this we know that the coronavirus will not stay long on surfaces, right? About 3 days. So that's it makes sense, but I don't know if there's a study that supports that.
What about the kanang mga the mask, the aesthetic masks that are being sold by online sellers? That looks good, you know, Korean or the
But
other types of
so
mask.
I don't have those with me. I really don't have any other mask. So I just have this KN95 mask. Aside from my 3M respirator, sometimes I use this one. So this is a it's part of the package if you want to volunteer. So it's KN95 mask. So this one
That's
by
new and sealed.
it's new and it's sealed.
Mm.
So um the KN95 mask, it's believed that it's lower than ang quality and effectiveness is lower than the N95. So nasa between on almost the same sa surgical. So other masks that are available, we have our fashion mask, the cloth mask. Those that one that you're wearing, it's called the necklace, right? Necklace. So they're not believed to have to give you protection. Sorry. They're not believed to give you protection against the coronavirus, but they can help protect from dust and bacteria. So it's still preferred. So actually, if those people would want to still wear that mask, naiuban na mag surgical mask sa ilalom. So underneath they have the surgical mask, and then if they don't want to be seen with the surgical mask, but it's not so fashionable, so they can put the fashion mask they want,
So
the
double,
reusable,
so
all double.
surgical and then
Oh, actually, na yung mga nakita na in ano. So, example, nag-dress sila, ano, nindot kailang dress, nindot kailangan nga, nasa light terno. Dami naman, di ba? Like now, right now, like, nanay terno nga, like,
mm,
it's a outfit na, tawag yun, na dress, then I mask na the same
color,
of color,
matching color. Mm.
matchy-matchy. So, like that. Naiyaban yung ano, or na bandana. Pero, may surgical mask sa ilalim. We think that it's better to provide a mask that gives protection, and then there are, ano na, um, replenish ng supplies. The box of masks would, you can get around 200 pesos, the the a box of masks, and
Box.
that's
Okay.
a box of masks would, wait, I don't have, a box of masks would contain about 50, 50, 49, 50, na sayang, 50 masks.
What
And
about
then
face shields?
face shield, it would really complement if we have the face mask and then you have face shield, because
So the
there
shield
are
is more for the
studies
eyes.
na, yes, okay, we already have studies na uh, transmission, it will pass through COVID, the coronavirus will pass through your mouth, your nose, and your eyes. So you need to put it. So personally, I use eye goggles because my mask is already very big and very, masangko man siya. So I use eye goggles for protection. But now, I think it's really good if we could have both, no? Pero still,
So
again,
you're not yet giving away face shields.
w- actually, we
Oh,
are looking at.
okay.
So, the campaign, going back to the campaign, so wait, going
Sidetrack.
back to no, sidetrack tayo. Education partly,
Yeah.
talking about the different kinds of math. So, going back to the campaign, um, there were people na who started to message me that they want to do the same. So they want they want to pack their own mask and then bring it with them when they go out, when they go to work, ilan lang ihatag sa guard, ilang ihatag sa basurero, and so, moto siya, naiuban yan, they do it on their own. Naapad jud ubay na ni try og reach out na mo join jud sila sa campaign. So, ang first partnership is with Hazel Anlo. She's my friend, a medical physicist also, and she is the baker of Season Manila. So she is in Manila. She's doing the partnership with her boyfriend, Kuya Joko. And then she's also doing the daughter campaign. So I try to orient when my partners or the current partners started to reach out, I first talked to them na parang 1 hour meeting, 2 hours meeting online, so that we could talk about how do you want to go with the sponsorship. For example, for her, for Season Manila, they will donate 20% of their proceeds to the campaign. And since it, I've been assisting Hazel with the preparation, we see that she could also manage the daughter campaign in Manila. So she's also giving out free masks to those who are along the roads, when she goes to the grocery, na yung mga makita na So that's her goal. I asked her what um what are her beneficiaries and yung target, no? So for me, I started with the beneficiaries na in families of patients at camping out the Fuente Osmeña Circle last sorry, not January, July 28th. So after that, with the help of the team from Office of the Vice President Angat Buhay Cebu, my donations through the campaign, the donations reach to the shelters of like the homeless shelter in San Nicolas proper. Also, the donations were able to reach the frontliners at Sam Miller's Hospital. So those were just uh, our beneficiaries for the meantime, since we're on hold pa sa relief operations. Since we're on hold sa relief operations, our next target was isolation centers and lockdown areas. So for these people, we think that it's good that we have additional donations like hygiene kits, yan eh, hygiene kits. So that's the next goal for me and for the campaign in Cebu. For the campaign in Manila, uh, he's wanted to to give out to those who are along the roads kasi mas daghan ang kanang mga nanginahanglan sa roads. Also, um, my friend and
So these are homeless or
yeah,
mga
most of them are
standby?
homeless. So homeless and then those sometimes mga standby siguro nasa road. I have not posted those pictures, but she will start she already started to give out um masks to those. So she does the baking and also giving out. And then other partner for the hashtag buy a cookie save a life. So we have a family in Surigao del Sur, the Bunyal family. I only personally know three of them. So Christine Bunyal, Lyle Bunyal, and also their brother Diggs. They also started the Sanity Project, and then from their Sanity Project, that's Lyle's cookies. They're baking also. So 50%, so when dako kayo, 50% of the proceeds will go to the campaign. So, parang karon, ang starting is that Hazel will do the partnership and then daughter campaign, while the Bunyang family, they bake cookies and then give it out. So again, we have two partners for the buy a cookie save a life. There is one um there is someone from Cotabato, South Cotabato, who messaged me last night that she also wanted to join the Buy a Cookie Save a Life campaign to donate to the Wear a Mask Save a Life campaign. So the Buy a Cookie Save a Life is for daughter campaign to the Wear a Mask Save a Life campaign. And then we're also looking for someone in Cebu. So ongoing, going back to that. So we are currently again on hold ang relief operations because we are trying to connect to a company para na ay collaboration. So collaboration in what sense? Since we know that wearing a mask is just one of the preventive measures, no? So other preventive measures is washing your hands or observe social distancing. So we'll try to get a company to sponsor and collaborate with us through those through those line of prevention. So that's it for now. But we're still continuously repacking. I have repacked masks here, ang bodega sa kwarto. Then this is the sample. We have packed two masks, surgical masks. So why do we repack it
Alternate.
two? So it's either you can alternate or it's either you'll need this today, need this tomorrow, and then if you have a friend with you or you see someone you might want to share your mask, so you can also share your mask. So I've I've encountered now I gave a mask to a Grab driver and then ingon siya na thank you ako ning ihatag kung na ay makalimot og wear of mask. So you know the endless ripples of kindness. So, it's so nice to hear na people are also taking care of other people. Parang we end up protecting each other. Ba? Protect yourself to help protect more people, and then we end up protecting, maybe reducing, flatten the curve very soon.
So can you give a demonstration how to wear a mask properly?
Ah, oh my, oh my.
Because you mentioned that
Ah,
there's,
okay,
even
sige.
if you have the mask, some people are not wearing it properly, or
Yeah. Okay, I get it. I thought like, so I have a mask. I'll find a mask na wala gyud na ano ha, wala gyud na touch. So this one, we have, this is how a surgical mask, diba? So there are some who wants it like this, no? Can you see? It's different. Kasi gitali na ko ang sides. So to give more protection kasi normally what we do is just you put the mask. If possible, can you hear me? So this one. You ibutang sa dunggan, and then this one, there is a parang there's a metal strip. I took it out from a damaged mask. So this one, manisa na siya metal strip sa sulod. So you need to adjust that, okay? And then, no, dapat abot siya sa ubos. No, you see? Then sometimes, because medyo luag pa gad siyag, di ba? Luag pa siya tanawon. You can, we usually like sa hospital, sometimes we twist it. So more na siya, similar, nearly similar na siya ani, no? But sometimes, if it's
mm,
really not enough, some of people would tie on both sides. So tie it on both sides. So this one. Sorry about the dogs. So, this, okay, you tie both sides. Parang na siya.
what type of knot is that?
No, just a simple knot.
Ah,
Ah, okay. So, yan na siya. Wait lang, where's siya? Okay, yan na siya. And then you turn it. And then, yeah. Okay. And then, when it's done, it's like that now. So, insert the morning sa side. And then the other one too. And then you can diba, put it like that na. So, medyo sealed na siya in a way. Better. And then, this one should go really up to their nose bridge. And
mm,
then, this one's a bust. So, if you notice, na ibang tao na maano siya, ano sila, di na sila mag-isod bang gud sa ginhawa. Ano, nako.
mm,
Sige. Very, you know, this is better than being intubated. You know, yeah, so you, you try to prevent. Prevention is better than cure, so like that. Proper wear mask. So adjust this one. Also, I have a case. Where's my N95? My N95 direct. Wait lang. So this is how you properly wear mask. Some people, ano, makitang ilong. So, di mo na protection ng imong ilong.
mm,
So, it does not serve its purpose. Also, some, parang,
mm.
makigstorya, dili siguro daw sila kadungog, makigstorya, somewhere. Wala siya gamit. Also, kung na-addict kay friend na kasapan siya sa, ay iyang mother kay kasapan sa vendor, kay iyang mother, iyang gibadlong ang vendor kay niubo daw ang vendor, pero iyang gitanggal yan. Ang vendor, fish vendor, doesn't want to cough on her mask ba. So,
Mm.
it does not serve its purpose because you are wearing a mask to protect yourself and then to protect others. So if you don't have the virus, you protect yourself. If you have the virus, you still protect others now from yourself. So we don't know if, example, right now, I don't know if I'm asymptomatic. Uh, maybe, so even at home, I wear a mask. most of the time. And I also do not eat together with my family na. So, because most of the time sa studies from like there are case studies ata or what they call that ng even sa UP PGH, ang frequent na causes of transmission among health workers is that health workers eat together, then did not observe proper distancing. Okay, sorry. So during dinner time, when I'm at home, I eat alone. I bring my food sa kwarto, and then when I pray the rosary with my family, I wear a mask. Like when I'm near me, because my parents are senior citizens.
So
So
what's the protocol for
or
uh let's say
or
like you demonstrated, so you're covering your
mm,
nose and your mouth, and then you want, let's say you want to eat or you want to drink water, so what's
yeah, that's a good question.
yeah.
Since people think na since anak ka na mag-wear kag mask, galing kang mukaon, ganyan ka mo inom, imo lang siyang ianak. Pero
Mm.
nung dumi, kani nga part sa mong area diri, yung
It's
area sa
exposed.
mong neck, exposed na siya previously. So you're trying to contaminate your
It's
mask.
afraid.
And repeat, when you, wear the mask, so it's better to take it off na. You put it aside. You hang it aside. And then, also the eye, what's it na? Con- contamination. You know, when you wear the mask outside, please do not, refrain pala. Please refrain from touching it. Just every now and then, magsige tag-ana. And this part, it's contaminated. Then, this one.
Mm.
So, magsige tag irog sa mong mask. So, it's recommended to refrain touching the mask, especially when you're in public. Because you do not know, you're not aware, you might not be disinfecting right away. You might not be frequently washing. So, ang imong kamot, yung rub sa imong eyes, like, sakit siya, may katol siya, ano. So, we don't know. And, it might be source of contamination, infection, actually.
When you're removing the mask and then putting it aside, how far should you be? How far should it be from your bedroom or something?
Diba,
Because you
wala.
mentioned it's contaminated, you know.
Okay. Oh, for me, di ba, ang atong, the recommendation is 6 feet, like, to social
So you're
distancing. You
so
can
you're
hang it,
social distance with your mask.
maybe not, maybe like 1 meter lang.
Okay.
Di man siya di ba, we usually, like, we observe social distancing because there are studies na even when you're not speaking, when you're not talking, the bad particles will go out of your mouth, and then there are air streams from your nose. So since your mask is not breathing, is there siya like,
Mm.
it's not it's contaminated, but it's not like a source. Example,
What if
we
you
just
are
wear the
there's an
mask, di
electric
ba?
fan and
What?
there's an
Ay,
air conditioning?
imo jud ibutang dito niya pa daw nimo. Imo jud gito yung magpa-infect.
So it should be away from any airflow
Yeah.
that's
Okay.
directed to you because it's already
Actually,
contaminated.
there are already um guidelines, not really guidelines, but instructions on how to make your room uh negative pressure, negative pressure rooms.
It's the first time I'm hearing
No, no,
that.
no. So, muna siya ang usual isolation room. They have to
Okay.
be, ano, they have to observe the uh, guidelines or like,
There's no wind or
ha?
wala
It's
hangin.
not no wind. Kanang, what comes in just parang gidirect mo ang airflow.
Mm.
So, if naka sa isolation room, nasakiton ka, so ang airflow, they have to direct it somewhere else. dili siya like open yun. Naiuban ingon ana. So there are different designs for negative air pressure rooms, and those are sa hospital usually. So sa hospital like if open, if open ang windows, I've I've tried swabbing, no, and also um, getting samples for the rapid test and for the mandatory testing for uh, hospital workers since I work in the government hospital. So sa katong isang time na ang swab, open air lang yun siya. Open air, like nakakara sa gawas. Ang katong gikuhaan mi og samples, like blood samples for the rapid test. There's just one is what's it called that one? Exhaust fan.
Mm.
Then naay kuan, naay uh, fan sa taas, ceiling fan, pero naay warning na please don't turn on the fan. Parang you don't spread. Parang direct lang. Like, pagawas lang. Um, directed ang flow. So, and that's different, different
Yeah, it's air
area na.
conditioning and
Oo, oo. Na ay, ang hospitals, they really have to observe proper airflow condition.
what's the next steps, or you mentioned that you're considering the face shield and other additional stuff depending on the beneficiary. So
Okay.
what's
So,
next for
um,
you for your campaign?
first, for the campaign, we started with repacking, just me repacking. So, second, it's involvement sa mga tao. So, we, those who are willing to share like 1 hour, 2 hours, I sent out boxes of masks, about four boxes of masks. I give them four so that na kay mga 100 ka packs. So, and then I send them like this. It's a pack. So the pack, this is a repacking set, no, for a repacking set. So for a day, they will volunteer. They will do the repacking at their own homes. I also assist them like we have to disinfect before we touch the mask. Like that. There, got guidelines. So this is a sample packing set for the volunteers. So this one, you can see it's the one I told you before. I open it now. So our pack of repacking set goes with a sample mask. This is a sample, so so that they will know the idea or they want to share it to someone, they can share it sa kasi nanginahanglan. And then we have a pack of plastic for the repacking. And then and we have the stickers. Okay, that one they will post it. So it says wear a mask, save a life. Not for sale. Please, not for sale. Dili siya baligya. And then we already added the social media account. So we have a Facebook and Instagram account. That's wearamask.savealife.ph. So I send it to them. And then I also ask them if they have scissors or scotch tape. If wala silang scotch tape, I also add small tape, scotch tape. And then for the volunteer, I make sure na may hygienic ang ilahang pag-pack. You know, we give them gloves, a pair of gloves, and then KN95 mask. It's for them. It's also a thank you, a way of saying thank you. No? Also, please protect yourself. You know, please protect yourself so that you will continue to help protect others. So that's it. I added a short quote. I saw this online. It says, the smallest act of kindness is worth more than the grandest intention. So we really want to emphasize and then call out people who would want to join and be proactive in this time of crisis, it's really not easy for anyone. No one is happy in this time of pandemic.
Mm.
So that's one of our involvement aside the those who just want to donate can donate in cash or in boxes of masks. Usually, pag boxes of masks, I ask them
Do you
first
have a
if,
specific
hmm,
supplier?
what?
Do you recommend a specific supplier to them, or
No,
it
I
depends
don't.
on the
No, it
them,
depends.
on the donor?
It depends on them. I'll just double
What
check
if
if.
they give you the non-surgical mask? What will you do with the mask?
Oh, I try to ask.
Surgical lang, Jud. Okay.
Oh, please. Uh, so some people would still wear the mask, the cloth mask. Before, I used the cloth mask pag nasa balay. Pero pag medyo taas na exposure, pila na ka months na I was not sure if I was asymptomatic since I had few possible COVID exposures. So, ayun, I wear mask and then really social distancing sa balay. So, if dili man kaya gyud og social distancing, yes, preferred gyud na mag-mask. But if wala jud tay kapalit og mask, wag gyud mo. Luoy sad ta, wala tay di man na makaon. So, muna, since di man na priority sa ubang tao, we try to reach out to those people sa in ana nga situation. Also, since, um, you know, as you can see, the kind of plastic, no? Nagkakay
Mm.
plastic kani, this will be waste in a few years, like that. So, future plans, we have, we're still looking at alternative masks na still not cloth mask. So,
Okay.
it's not cloth mask. Cloth mask. Ano siya, since I had a partner na, si Hazel, was actually my coworker in NKTI. Uh, he's a medical physicist too. So when we talk about um, sponsoring boxes of masks for Metro Manila to be distributed to Metro Manila through the campaign. So the donations na I was able to gather, I also uh, shared it to her since it's a daughter campaign. No, we talked about what to buy, where to buy. So at first we were thinking, okay lang ang cloth mask since also it's it's also recommended. No, not actually recommended, but it's in
The most
WHO
accessible.
man na ano for non-medical use they can
Mm.
use it because we have to really reserve the medical mask for them for the healthcare workers. But as of as of the moment, since there are already um, stocks for the surgical mask, that's why we really go for the surgical mask. And then we're looking at this. There is a kind of mask now. We're still studying, like reviewing. Since the doctor was a doctor or a group of doctors, the residents from her workplace, suggested that kind of mask. So we're still looking at um, its effectiveness and it what you call this one. It's cost actually. It's cost because it will
Mm.
be more way expensive than the disposable mask. So that one, we're looking at alternative mask that is maybe reusable, most likely reusable. And then we're also looking for um, we're also looking for face shield. So since she's in Manila, I also have a full of friends who are supporting me. So I try to connect those friends to her so that we could like I want to build a support system for her also. So not just for me, for her, so that we will continue with the campaign in Metro Manila. And then sa Surigao, since they are a family, it's really nice now. They have to they will donate part and sorry, part of the proceeds. Um, wala pa na ako sila na ask if they want to repack the mask, but we'll try, we'll see. So again, we're looking for face shields since uh, more mahimo na siyang requirement
For
by
the
the
new normal.
government and new
Okay.
normal. So since it's already
It's
no, it's already
inevitable.
out. It's
Mm.
that it's inevitable. So we're trying to look for affordable that would be good for the
Supplier or
district.
material.
Ang material, we check for the material, and then the suppliers. So we're still looking at those. Ano. So on hold ang pag-buy of surgical masks since we're looking at alternative masks, and then we're looking for suppliers for face shields, and then beneficiary wise, so target beneficiaries or areas. Um, our next goal is the isolation centers, lockdown areas, also communities like the shelter of homeless. Um, for now, since they were already in, um, we're already seeing that it would be inevitable na we need face shields for our tricycle drivers, our jeepney drivers, since you can see na ang uban wala pa work, so wala pa sila na masahe, wala sila sweldo, wala sila kwarta, wala sila kakaon, wala sila kapalit mask.
If
So,
you can afford
you
it,
know,
yeah.
we need to help get free masks. And if possible, we get more budget para maka-purchase og daghan na face shield. And then we continue to serve and give out to the frontliners. I'm thinking of looking after also to our PWD. So, di ba, karon medyo lisod, if deaf mute ka, how will you be able to properly communicate if nakamask ka?
Mm.
Usually, they lip read. So, let's see if we can get sponsors for, you know. Actually, I am in contact with a friend. Their family supports deaf mute
Mm.
communities, and they are
Affected.
trying this what we call this one accessibility map.
Mm.
So for Cebu City, we I also have a friend who's deaf mute. I can try to reach out through him or through organizations sa Cebu, Manila. Sa Cebu, Manila masyado. And try to reach out to them also in the future pa since we need to prioritize ganun, isolation centers and lockdown areas. So hopefully we can get a collaboration or find sponsorship to get more hygiene kits. We're really looking
Mm.
for hygiene kits right now.
So it's
So
mask, face shields, and hygiene kits.
yes, because we need to we need to emphasize that it's not just a mask. This won't solve everything. Yeah, this won't solve everything. You need proper hand washing, frequent hand washing, and we still observe social distancing when eating outside. Kasi ba na may dine-in? Na may dine-in. So we try to observe social distancing. We really don't know if it's really sad. No, I've seen fitness like families na ano na igo gyud na lisod sad gyud sa situation, and then there are times na ang family members since namatay ilang mother, ilang father during this crisis, and then COVID positive gyud, um sila gina-isolate, di ba? We need to isolate them sa other family members nila or like sa ilang neighbor. So lisod gyud actually ang situation na that's why we need to emphasize on the preventive measures. It would really cost you a lot if masakit ka, no?
Mm.
Given na,
As they say, mahal mahal magkasakit.
Mahal na sa hospital. Mahal jud actually, kanang makita ang mga post na how much they spent,
Millions
yeah,
for COVID only.
for COVID only. And then, uh, right now manon, I think medyo luag na
That's for
ang
one person.
hospital. No, I know, oh, for one person, no? Before like a few weeks ago, um, naay waitlisting. So,
Mm.
naiuban na mamatay na lang nga wala man na nakasud sa ospital. It's really hard. So, we have to keep protecting ourselves, protecting others, you know. So, we help flatten the curve ba, and then reduce the burden sa atong healthcare workers. So, that's it. It's a small campaign. I really started like just me sa kwarto,
Mm.
repacking the mask, and then now we have two and maybe two more partners. Hopefully, itong sa Cotabato, and also in Cebu, hopefully. I just hope that we have more supporters, and then we also reach out to more people to raise awareness, because it's not just simply wearing wearing a mask, uh, ang campaign, like ang free mask, free donation, free food. We also want to raise the awareness of
Awareness.
proper, yeah, yeah, we
You
really,
already
really,
demonstrated.
ah. So, yes, we started also this photo challenge on social media. I hope it would reach to more people na you have to wear a mask for preventive measures. So, to keep yourself and your family safe, that's one of the things you can do. It's the simplest thing, but you have to ano, still bring this kind of awareness. That's part of the donation drive. So we try to donate tarpaulins, also infographics, so that we can they will put it on their communities. So really thankful to those who supported from the start. Um, wala pa nag 1 month actually from July 24, but the campaign has grown way bigger than I thought. Like I thought like I would just be giving out the mask on the Monday, next Monday, and then okay. But people started to like, hey, I wanted to do this. I wanted to help you. I want to join the campaign. I want to donate. So it's really nice to see.
A chain
So
reaction, no?
oh, it's a chain reaction too. It's ripples of kindness or somewhere shock. And I just hope na we don't have a due date for this campaign. So
So long
I
as there's
thought
still the pandemic, it's gonna be
actually
there.
there was someone who asked me this one. I posted down na because I posted before na if God permits, if this is what we plan, I'll try to seek more communities that we can help, I can help. So through the campaign, hopefully until na flatten na or so reduce na. Hopefully very soon. I did the math kanina since there was also someone who asked. We were able, as of the moment, since July 24, we were able to donate around 1,500 masks in Cebu and in Manila. So hopefully
Is
we
that
get
is one pack
one
or
thousand one five
one pack,
one
or you
five
counted the two masks in one pack?
masks, the mask
Okay,
itself.
mask. Okay.
Since there are still masks here, like more bodega akong room. Pero
Mm.
I know they're still waiting for the confirmation of the collaboration for and sponsorship for the hygiene kits. And then again, we're still looking at um, where we could reach out to the tricycle drivers and Okay, that one. But we're still waiting for the face shields. So
Mhm.
hopefully we can
You have the full set na.
um, fully set now to have community service. The campaign still open. Donations and volunteers are still open. And check out our Facebook and then Facebook and Instagram for updates.
So that's about it for this episode of the podcast. As you may have noticed, I'm not really talking that much because this is not really like my area of expertise, and this is also to give a chance for our guests to talk more about the campaign and what the campaign needs, what the next steps for the campaigns in the future. So make sure to, if you're interested to donate or to volunteer your time and effort, uh, reach out to the Facebook page of Rosa, and I will include the links, the related links in the description, so you can reach out directly to the page, so para ma-monitor sa easier for them. So thank you very much, Rosa, for joining me again in this podcast, and see you guys next time.